know the why human trafficking work is needed, to fight for the freedom of modern-day slaves. But love, passion, commitment isn't all you need to be an effective and successful anti-trafficking advocate. Learn the how. I'm Dr. Celia Williamson, Director of the Human Trafficking and Social Justice Institute at the University of Toledo. Welcome to the Emancipation Nation podcast, where I'll provide you with the latest and best methods, policy, and practice discussed by experienced experts in the field so that you can cut through the noise, save time, and be about the work of saving lives.
Welcome, Lisa. Lisa Belton is co-hosting with me on the Emancipation Nation. So tell the people who you are.
I thought we did this already.
I know, but everybody doesn't listen to all the episodes. So tell the people who you are.
All right. Well, I'm Lisa Belton. Got a master's degree in social work. 5'5", single, ready to meet someone. I'm just kidding, but seriously, I don't know. I love like going on walks, although by myself because I like to listen to music. So, you can't go with me. I love thinking, processing, debating, being part of the change in the world.
Yes. And do you think there's anybody else in the world like you?
Of course, I think lots of them. I mean, I believe most of your listeners are just as passionate.
No, I mean, do you believe that everybody has like a doppelganger?
Doppelganger? Like, oh, you mean like a person that's exactly like you, but is living somewhere else in the world?
Yeah. But not somebody that's living like in an alternate universe, but somebody that's actually living in another region. Somebody that's sort of like you, but isn't you, like your twin or your duplicate or something?
Oh, no, I mean, there's only one true Lisa Belton, right? But I wish there was another one because together, we conquer the world. Like, just think how much I can get done if there's another, like one of me doing the things I want to do.
Right, exactly. So I feel like my guest today is that person. Her name is Celia. I don't think I've ever met another Celia before. I met Cecilias, but not many Celias. She's Black. I'm Black. Her last name has 3 syllables in it, McIntosh. My last name, Williamson. She has professional degrees. I have professional degrees. She's a PhD. I'm a PhD. She's an anti-trafficking advocate. I'm an anti-trafficking advocate. She's totally serious about the work she does. She's an organizer, getting people together to run a very thoughtful coalition. And as you know, I started a coalition here in my community back in 2009. She's very impressive, but I might be biased about that. And I think she does absolutely amazing work. And, I'm probably biased about that. But she is my spirit sister in the Massachusetts area. And she's going to talk about her work and her coalition. And then on the back end, I want to discuss and process her work. And I also want listeners to hang on because I want to talk a little bit more about coalitions and have people think about how they can better assess and better improve their coalitions. Because let's face it, like a lot of the work in communities gets done through coalitions. So coalitions aren't perfect. And I want to talk about how to improve your coalition. And particularly, I want to talk about how not to drink Kool-Aid. And so I'm going to tell you what I mean by that on the back end after we listen to this interview. So let's get to the interview with Dr. Celia McIntosh. All right, welcome back to the Emancipation Nation podcast. Today we have Dr. Celia McIntosh. She's a nurse practitioner by trade and advocate by choice. She's passionate and she leverages her skills, her experience, and her expertise to become a voice for policy and social change and to reduce health and social disparities. Dr. McIntosh has 17 years of experience in the health sector as an educator, clinician, consultant, and as a human rights advocate. She got her doctorate of nursing practice and a master's in family nursing and a postmaster's in psychiatric mental health nursing. She's currently the president of the Rochester Regional Coalition Against Human Trafficking and the vice chair of the inaugural Police Accountability Board in Rochester, New York. And she's a founding member of the Rochester Black Nurses Association and serves as the current vice president and health policy chair. So welcome, Dr. Celia.
Thank you for having me, Dr. Williams.
Yeah, and I'm liking your name, Celia. Pretty cool name, kind of unique. You're the actually, I think you're the second person I've ever met named actual Celia, not Cecilia.
Yeah, I would say the same thing as well.
I know, so pretty cool. So tell us, I know you are very active. I've known you for years. So tell us about some of the projects that you're working on, particularly what about something about care packages or something that you do? What's that about?
Right. Thank you. So one of the other projects that we've been doing is a survivor fund. In 2020, we decided that we have a lot of organizations that we're working with that are working with individuals that have been trafficked, and oftentimes whatever grant or services they offer can't really cover things. So, maybe they need the rent paid, or maybe they need a portion of their car insurance paid, or maybe they just need food or diapers for their child. So we decided to develop this care pack, and those organizations reach out to us, and we're able to help in that way.
That's so awesome. And you also, you haven't stopped there. So tell us about the Yes Here campaign.
So we actually started that initially in 2016, and really that was a way to get our message out in the greater Rochester community that, hey, human trafficking, it's here, yes, here in our backyards. And what we've done, we have partnered with the Rochester Transit Center, like RTS, the bus company, to really develop, and the RIT, Rochester Institute of Technology, they have developed some posters for us. And we have partnered with RTS to get our message on these different bus wraps, different monitors, different inside cards, and even shelters to really say, hey, yes, here, human trafficking is here. You need to pay attention to these issues. These are some of the signs and symptoms. These are where you can get help. And there is an organization here in the community working on these issues.
And did you do that as a part of the coalition? Is that how that gets distributed?
Yes. So we actually, one of our members was a faculty at RIT at the time. And this was one of the initiatives, of saying, how can we use arts to really help inform the community about this issue? And then, like I said, to piggyback with the RTS company, we just thought, these buses go all over the city. So this would be another way to increase our reach. So it's a part of the coalition, but we are still doing that initiative. And actually, we just wrote a grant to try to see if we can, Project Yes Here, to combine education and a care package project for the community and the survivors.
That's awesome. And we have been partnering with our local transit authority as well. And we have human trafficking information inside of all of our buses and have trained our bus drivers, and just got a federal grant to now put some monitors in the buses so we can have somebody verbally describing trafficking and resources available and things like that. So I think that's a great partnership and a great idea for other people who are listening that might want to do that in their communities. So let me ask you just about your coalition. What's the makeup of your coalition? How often do you guys meet, and what are some of the kinds of things you guys do?
So our coalition formed in 2013, and the reason why they came together, there were a lot of different organizations working on the issue of human trafficking, but really in silos. So our coalition, there's individuals and organizations. I am a nurse practitioner, found out about the coalition the first time in 2014 while I was walking into work. So I don't necessarily have an affiliation, but Other members of our coalition include the Center for Youth. They work predominantly with children. They have a shelter. Other organizations include Bright Star Communities. So they're an organization that just started a safe home for women. Others include, Church Women United, and then the Jewish community, Jewish National Women of, sorry, I'm losing that.
Yeah,
But,
something like that. Women and
yeah,
Jewish and
community. I can't remember the acronym off my head, but this is essentially the makeup. I'm right now the only nurse, but there's been social workers in the group. There's in faith-based organizations in the group. There were actually a legislative aide for Chuck Schumer that had joined when she found out about the issue, and actually she joined because she said, I kept seeing your bus wraps all around the city, and I figured
that's
I
awesome.
should join. So, there's a variety of different people. We've had a few elected officials that are a part of the coalition because they want to be in the know about what's going on. We don't have any survivors in the coalition that we're aware of, but that's essentially our makeup. Just really concerned citizens that are just, refuse to just sit by and do nothing.
And so what are some of the things your coalition does?
So things that we do, like I said, we do a lot of education. So we've educated faith-based organizations. We've talked to social workers, hospital organizations, really to educate them about the issue of human trafficking. We've gone out and we've educated police officers as another way. We've talked to youth counselors. Another thing that we do on an annual basis, we have an annual proclamation. So we invite elected officials and we talk to them about, give them an overview of what human trafficking is, what's the state of it as we know it, and some of the policy initiatives that or recommendations that we have for them that year. So really it's about another thing that we do, we really just collaborate and connect with other organizations that are doing the work or maybe know nothing about the work. And we often meet once a month. Now with Corona, we meet virtually, but that's essentially what we do.
That's what our coalition does as well. But I love the idea that you meet with the politicians, and do you tell them what you need, or explain the proclamation a little more?
So, yeah, thank you for that. So when they come, we just really initially we give them an overview. We say, this is a problem here, and we want you to educate other people to really be on the lookout for it. But at the same time, we're also having a call to action for them to say, we don't just focus on bills that are specifically about human trafficking, but if there's a bill that pertains to a mental health bill that may impact human trafficking victims, or a bill around child abuse that may impact human trafficking victims, or if there's something related to prevention where we're talking about maternal home visits that may be good for prevention aspect, we talk about those things as well. And if there's anything related to labor trafficking, the bills that are in the current legislation, we talk to them about that too. So we really give them a lay of the land in terms of what's the issue, what's the problem, what's the scope of the problem, and what are some steps that they can take in terms of, legislative, steps that they can make.
I love that. And if I may translate it, politicians, you work for the people, of the people, by the people. Here's what you should go do for our community.
Yes. Yes.
I like that. Instead of waiting around for them to pick it up, you make sure that you invite them or meet with them every year to challenge them and tell them what they can go and do for the issue, and educate them around that. I think everybody in a community could put that on their agenda and start to do that. You have some very good, solid, and practical ways that your coalition gets involved, from developing these care packages to the survivor fund to talking to politicians. I mean, those are very, there are lots of coalitions that sit around and process and process and process. And it's like they need a balance between process and accomplishment. And being able to use a group of people in an effective way I mean, those are three ideas right there that coalitions could use and be very effective in meaningful ways. So I love it. Any advice that you have for people who are running coalitions or who want to get involved in this work?
So since 2016, when I became the chair of the coalition, I noticed some of the members would focus on, they didn't want to go out and do education to groups that were less than a certain number. And for me, I always say, there is a power of one. So, as long as there's one person there that you can get your message to, you never know what their circle of influence may be. So I would say don't focus on just the numbers. Go out, spread the message, do the good work that you do, even if you don't have a lot of people. I could say that we have about 12 people in our coalition. Maybe 6 of them are pretty active. But in that time, we've still done quite a bit of the work. And we know that the difference is going to come when we keep the momentum going to do the work. So I would say don't focus on the number, even though you may have a small committee. Continue to do the work. I'm always willing to give any tips or any strategies. So I would offer my contact info as well. But I would just say it can feel daunting. But I would say the work that we're doing is very important, and continue with it. So
wow, that's amazing.
Thank you.
So how do people get in touch with you, Dr. Celia, if they do want advice or they want to get some kind of consultation or coaching in terms of their coalition?
Okay. So my email address is drnurse58@gmail.com. I'll repeat that, drnurse58@gmail.com. Or you can find me on LinkedIn or Instagram at DOC_McIntosh, MCINTOSH.
That's awesome. Now, you also developed an assessment tool for healthcare providers. Can you talk about that?
Yeah, so because of the work that I had been doing with the coalition in 2017, there was a public health law that basically came out and said organizations have to have policies, procedures, and treatment protocols for individuals that have been trafficked. So we developed a task force, and through that task force, I did some research, and we develop a protocol. So the protocol includes, looking at being the observant as the nurse, looking for the different red flags. Also embedded in there was some specific assessment questions that, from a CAS study, that previous survivors said were good questions to ask them to figure out if they were being trafficked. So those were embedded also. So we have done essentially a policy, a protocol. We've embedded that into our electronic medical record in September. And now we've, of course, done a protocol a PowerPoint to educate staff about the issue of human trafficking and next steps of what we have to do. So, and then with that whole protocol, with like I said, the assessment part of it, we also have added resources in there, community resources, calling the National Human Trafficking Hotline, looking at, contacting some of the resources in the community for the immediate care. But we have those documents all in one space and now into the electronic medical record. So it's easier for the staff to really be able to have a seamless process. So that's one of the things that we did. And I definitely think it's working. We just have to go back and evaluate if we've been able to detect any individuals that have been trafficked.
And now, is this for any nurse, or do you reserve it for sexual assault nurses in hospitals or any healthcare professionals, or who is this designed for?
So it's really designed for pretty much anyone. The way it works is when patients come into the ED, the nurse would do the initial observation if she sees any of the red flags. If she feels like there is some positive, assessment, then she would kind of contact either triage or get the social worker involved. The social worker then would ask more in-depth questions and be able to get a better idea of some of the social issues, or if this, what the safety concerns are, and from there do the next step in terms of, if this is a minor, do we need to call CPS? If this is an adult not willing to, leave this life right now, how can we connect them with services? Once they get admitted to the hospital, all the nurses on the floor pretty much do the full screening from the observation to the questions. And if you're working in a facility where you say, okay, this is rural, we don't have access to that, a doctor can do it, anyone can do the actual screening. So it's really for anyone, but it depends on what area of the hospital they're in at that moment.
I see. And the ED is the emergency department?
Yeah. So
And-
go ahead.
Oh, is this suitable for a clinic as well?
Yes, because what we were finding out was that the bulk of the population of the individuals that came in contact with healthcare providers were in the emergency rooms, were in outpatient clinics, were in urgent care. So we would definitely say, and we have utilized this tool in those outpatient centers as well. So definitely, like I said, it can be utilized. It can be generalized to any area in the hospital or outside of the hospital.
And is that a tool that you train people to use? Is this tool accessible to people outside of your area? Like, can anybody use it, or do they need to be trained, or is it something that is specific to your community?
I would honestly say anyone can use it. We basically, the way the tool came about was that we just embed it. You have to have some kind of basic knowledge about human trafficking, the social issues and the red flags. And what we did was we took the most common red flags and embedded those into the initial, that would be the assessment part. These are the things that you're looking for, paying attention to. But but then you're also kind of going with your gut if something doesn't feel right in the interaction with the patient.
Mm-hmm.
Then from there, the next step, like I said, if you feel like something's positive, then you're going to ask these 3 screening questions. Is someone forcing you to have sex with them for money, anything of value, or do you feel intimidated by this person? Is someone holding your ID? These are basic things that we essentially got out of the literature that we're now embedding into our, screening process. That essentially, but this is all stuff that's been, reviewed from the literature. So essentially, so if someone's willing to, if someone wants this, I can definitely copy that and show them or email it to them of how our process is. But this is, like I said, essentially what we've acquired from looking at the literature.
And so if they wanted to get a hold of that, or even use it as a sample of something they might design for their own community, do they use the email that you provided to get a hold of you to get access to that tool?
Yeah, and I'll give the email again. So that's going to be dr, like Dr. Nurse, drnurse58@gmail.com.
That's awesome. So what is in store for Dr. Celia for the future? Where do you see yourself going next or doing next in the issue?
Well, one of the things that we did do for 2020, we wrote a large grant because we wanted to put on a conference similar to the one that you have every year, a human trafficking and social justice conference, to really help people in our community, because we know that Rochester is the 3rd poorest city out of 75 metropolitan. It's the 2nd highest police out of 75 metropolitan cities its size. So there's a lot of social issues right here in our communities that can increase people's vulnerability to trafficking. So next steps for us is really to continue to roll out that conference. I have started a podcast called Sitting with CC, just to talk more about those social issues, just the isms, the classism, the sexism, the racism that makes people at increased risk, and because these are essentially foundational to abuse. But I would like to do more speaking engagements. I would like to, do more with our, coalition in a whole, educate more people, and then figure out what other alternatives do we have to improve. Maybe we can get a survivor-led a part of one portion of our organization to have, some kind of survivor-led initiative. But just really wanting to grow the coalition, really want to continue educating people, providing programs, and just continuing to try to help create more sustainable programs for survivors after their aftercare.
I love your heart and I love your mission. And your podcast, Sitting with Cece, what does CC stand for?
So it's just my name is Celia, but in high school people used to call me CC when I played basketball. So it just kind of stuck. So I just use that because it's really simple, so it doesn't necessarily stand for anything. It just was kind of a nickname.
Okay, so are you my doppelganger? Because I played basketball. My nickname was CC. If someone calls me CC, I know they have known me, 30 years ago.
Yeah,
because that was my name. This is so weird. So, where do people get access to your podcast, Sitting with CC?
So it can be found really on any platform, Anchor. It can be found on Buzzsprout, iHeartRadio, Google Podcasts, Apple Podcasts, any of those.
That's awesome. Right. Well, I have to come on your podcast because I love that you are focusing on the racism, sexism. And so let me ask you, this sort of last question is, how is it being a Black woman working on the issue of human trafficking, or even looking out across the land and looking at racism and sexism and all of the isms? Has there been a particular struggle for you as a Black woman?
Well, I think in a way, I think I'm able to be more relatable than some people, because when I think back on my life and growing up in a single home, my sister was a runaway, growing up with violence in the family, I look at, the work that I'm doing now and saying I could be in the same shoes. I could have been just as vulnerable as, the individuals that we're trying to educate for about human trafficking. So for me, I think that there's, this relatable component of it. I just kind of went off in tangent. So repeat your question, please.
No, I think that you answered it. It's being raised. The question was, what's your experience, I guess, as a Black woman? That's not even the question because I have forgotten, but it was around this area of how to, how as a Black woman, are you affected by human trafficking and all the isms? Is there a certain way that you see the world, or a certain struggle that you undertake, and those types of things?
I would honestly say that when I learned about human trafficking and started doing my own education and found out about all the risk factors that make people vulnerable, that made me want to be a better advocate. It made me want to go to other tables like the Police Accountability Board, like the Children's Agenda, to understand how these issues are impacting people in our communities. So I think just working on this issue and it gave me a broader understanding and a broader kind of charge for change, because like I said, there's so many different vulnerabilities, and now I feel I'm holding myself accountable because I know that the majority of the individuals that are being trafficked are Black and brown individuals. So like I said, with that disparity itself, like I said, I just feel like I have a greater charge to do the work for everyone, but at the same time, because those other social issues are at play, I feel like I'm able to relate to those. Therefore, I can try to do a better job as an advocate. Granted, I don't know everything, but I know that I too could have been vulnerable. So it just makes me want to work harder for the work that I'm doing.
Absolutely. And it gets us to recognize that as advocates, in this issue, we are bringing to this issue our perspective, which means if we live in a country where there's racism and sexism and homophobia and all the things, then we as advocates just inadvertently bring those into our advocacy work to fight human trafficking. So I've been saying, our next 20 years, we got to be focusing on partnership and privilege, how that's affecting our movement, and power, and how that's affecting our movement. And yeah, we've got to start having these conversations. We're the good guys, yes, but the good guys have brought to the table all of their issues. And so, we have to work through that as well. And the first road to recovery is to acknowledge that, we brought racism and sexism and all the things to the table as we try to fight human trafficking. So I was just curious, as one Black woman to another, what are some of the extra struggles? And I quite agree with you that it does give you an extra sense of responsibility, motivation, inspiration to do the work, because we know disproportionately, people who look like us have been affected. So thank you so much. Yeah. Thank you for being my doppelganger over there in Massachusetts. And I'll hold it down over here in Ohio.
Okay.
And
thank you.
yeah, we just got to find some more. And there's plenty out there that are holding down their states and making people accountable and making people come to the table and do the work. And that's what it's all about. So
Definitely.
Last thing is, so what do you do, Celia, for relaxation and fun? Like, you're not just doing this all the time, I hope.
Trying not to, but it just seems like I'm advocating on one issue or the other, which doesn't leave me a lot of time for self-care. But what I am, I do like to watch my good movie every now and then. I haven't been working out as much as I'd like, but that's another thing that I do like to do. Listening to music is always good. I have a few side businesses that I'm doing. I have like a little online retail store and a little online coffee shop called Pour Me a Cup. So I'm trying to kind of get those up and running as, some other activities or hobbies that I like to do. But like I said, for me, this work, I've been wanting to, I know going into nursing, I wanted to do advocacy. I wanted to advocate. I didn't know what that advocacy would look like. I know that I wanted to advocate for patients and their families. So, I find this work enjoyable and I don't feel like it's work. So, like I said, for me, it's just an extension of my life. But honestly, I miss sitting at a good coffee shop and just being able to people watch and, listening to music, like I said, is always good, and working out, but not doing it as much as I'd like.
And where can people find what do they purchase at Pour Me a Cup? Do you sell coffee?
Yep. So I sell coffee, and then there's some K cups and coffee, and then I have some merch, some just some different.
Yeah,
mugs.
That's awesome. And what's the retail store?
So it's called Dr. Celia's Closet. It's on Poshmark. So it's essentially just me reselling things that I have here that typically, usually I have no time to wear. So a lot of the items are shoes and clothes that still have tags on it. But that's one of the things that I like to do, because fashion was, my thing. And but now it's just like, if I'm not wearing it, or if it's just going to sit in my closet, I might as well pass it on to someone else.
That is so awesome. And that's where we differ, because I did not, at least I found something where we differ. I do not want to dress up like ever, never. And there are no clothes with tags on them, because, I wear them if I buy them. And I probably couldn't have gone through all of the anatomy courses that you did. So I'm glad you have that kind of brain power going on. It's not going on over here. So, but that's awesome. I'm glad you have an entrepreneurial spirit. I do too. So
yeah, thank you.
Yeah. Well, thank you, Dr. Celia. I appreciate you so much. And thanks for taking the time. And, I just wish you Godspeed on all the work that you do, as well as your side hustle, your side business. So keep doing the great work.
You too. Thank you very much for having me on.
Thank you.
Wow. Very cool interview. She's been involved for over 17 years, like major commitment.
Yeah, she's holding it down over there in Massachusetts. I like that they do these care packages of food and toothbrushes and deodorants for survivors. And also the Survivor Fund is a really good idea to help survivors meet their needs for rent or go back to school. I think that's very cool as well. And that podcast, Sitting with Cece, that's very cool. Talking about racism and all the things. And, my nickname is Cece. Like, again, my doppelganger. But if somebody calls me Cece, I know it's somebody that I knew like 30 years ago, like back in the day, back in the neighborhood.
Right, right. And the screening protocol for hospitals I thought was great. I really like that. And since she's in the healthcare field, she probably has one of the better ones.
Yeah.
And her coalition sounds awesome. It, sounds functional, consistent, and diverse. I like that she has healthcare folks. She has the churches, safe houses, political folks, just a lot of different people on the coalition.
Yeah. And so that's the reason I wanted listeners to really stick around at the end, because I think who you have on your coalition can really make or break your coalition, because those are the people contributing, and ultimately those are the people who help determine the direction of the coalition. So there are really three main mistakes that I see coalitions make, and they're very costly mistakes. So first, one of the main mistakes I see coalitions make is that they have one discipline dominate their coalition. It's a tragic mistake, because it's one that costs coalitions greatly, and thereby costing survivors, because it inhibits your ability to make meaningful progress. And that's what I mean when I mentioned earlier drinking the Kool-Aid. Like I'm a social worker, so I could come into this coalition with the social work mindset, and I can believe that social workers are the only ones that can ever really save this whole issue. Like we have shown up, here we are. And all I can see, think, breathe, act is social work. And I see lawyers come to coalitions, and they're like, we are here. Legal justice, that's the most important thing. I mean, if people don't have freedom, then people have nothing. So we are the most important thing in the room. And I see healthcare do it notoriously. Hey, if you are not healthy, you're dead. So we are the most important people at the table. And then criminal justice, police officers, hey, if we're not arresting the bad guys, nothing's going to get done. So we're the most important. And everybody is saying they are the most important people in the room. And that's what I mean. You go into that discipline, you get 4 years of education or whatever, you come out with your degrees, and you have drank the Kool-Aid, and you can't see any other discipline except yours. And you don't respect the other disciplines in the room. But let me tell you something, that's a fatal mistake, because you are nothing but a slice of the pie. And all these other people are other parts of the pie. You need all the people at the table. So you need to learn to be bilingual, to speak their language, to understand their perspectives, so that you all can move forward. Like, the African saying, you want to move fast, go alone. You want to move best, go together. So I think that's one fatal mistake. The second fatal mistake I see coalitions make is they hold on to their coalition. Whoever developed, designed, or brought the coalition into the community, like they keep sharing it year after year after year after year. And so the coalition can't outgrow you. It can't move beyond you. So start the coalition, stabilize the coalition, and give the coalition to the coalition. Let the community run it, share it, stabilize it, then step back, become a member for a few years. Let it get life's blood. It can't outgrow you unless you step aside and allow people to own part of it. So I think that's a second mistake. And then the third fatal mistake is really coalitions that don't establish balance between process and movement. Like they come to the meetings, they process. Trafficking bad, we ought to do something. Somebody ought to do something. And then they go home. And people that are influential, people that are ready to roll up their sleeves, they're only going to come to those meetings so many times because they don't want to sit and process. they're ready to do, or coalitions that move too fast. They accomplish too fast and they haven't gotten people on board. So there's a balance that needs to be struck between processing and actually doing and achieving. That is the delicate sort of balance. And so to Celia McIntosh, my sister in the game, I hope you stay another 17 years and beyond. Continue to do the great work you do. And also, please check out Cece's podcast to learn more about all the isms, racism, and sexism, and more that are really the underpinnings of human trafficking and so many other issues in the world today.
Let's not just do something, let's do the best thing. If you like this episode of Emancipation Nation, please subscribe and I'll send you the weekly podcast. Until then, the fight continues.